The art of medicine comes with your relationship with people. And what's been great with pMD is you can incorporate both the science and the art of medicine. I'm Pauline Harding. I'm a family medicine doctor in the greater Chicago area. I've had many years of working with patients and sharing their lives. I know their children, I know their grandchildren. I even know some great-grandchildren. A lot of family medicine is just being a good grandmother. I had been practicing in my own practice for decades. I eventually just closed the practice and started working with a local urgent care. All of a sudden, the world was struck by a pandemic, and the practice of medicine changed overnight. Fortunately, we had pMD already set up, so we could do video conferencing, we could do text messaging, I could keep in touch with my patients and my colleagues as needed. But the acute care facilities, such as the immediate care at which I had been seeing patients, were so dedicated to treating COVID-19 patients that the manager essentially apologized, saying, "I'm sorry, we just don't have the resources to dedicate to the chronic care patients, and I know that most of your patients are the chronic care patients." And at that point, the staff at pMD pointed out that they would be able to take over a lot of the functions that I had been counting on the immediate care for. They offered to do the billing for patients and help submit claims to their insurance. There's a lot of coding that needs to be done. There are a lot of regulations regarding that coding. It was such a relief to hear that pMD could take care of all those aspects that as a physician you don't consider them as a direct part of the care, but you realize how important it is. And what has really amazed me is that I can essentially reopen my practice. Colleagues who are really excited about it actually are the specialists and my clinical assistants. Through pMD, I can have someone help with the scheduling, check-in, credentialing. The charge capture is a click at the end of my office visit note, and then the billing is taken care of. And with the pMD staff, one is more helpful than the next. So it's been such a delight finding tools such as pMD that allow you to get the job done for the patient and not throw quite so many roadblocks in your way. Having all of that under one roof and quite reasonably priced has been an incredible blessing.